Yeah, I had a question about breast milk versus formula milk. Is there a specific reason other than like a personal preference why a mom would prefer to use formula milk over breastfeeding?
Even amongst physician mothers, and I'm not talking just mothers in general, I'm talking about women who have babies that went to med school, even among them, there is a debate. I I think most would say you should try to breastfeed, especially when taking into consideration mom's mental health and the millions of things that she has to do and how utterly difficult breastfeeding can be for some, if not most, women. Uh, they have been able to replicate much of the nutrients that are in breast milk. And in fact, formula has vitamin D in it that breast milk does not. So if you're exclusively breastfeeding, you are supposed to supplement with vitamin D drops. So there's one thing that formula would have over breastfeeding. But actual breast milk is going to have antibodies in it from the mom, which isn't going to be in the formula. So the American Academy of Pediatrics and pretty much all professional medical societies would endorse breastfeeding, probably not at the expense of the mental health of mom. You don't want to take this tactic like breastfeeding at all costs, like even if mom is completely dysfunctional and in agonizing pain and can't do anything else, even if you don't care about mom at all, which I unfortunately feel like some schools of thought don't care about mom at all, you do have to care about mom in order to care about baby. So if the breastfeeding is just so taxing that it negatively affects mom and say they don't even care about mom, which they should because like she's a human too. If mom can't take care of the baby, then bad stuff happens to the baby, right? So I think formula is great for moms that are struggling. And like also like what if you just literally cannot produce milk? Try as you might, it may be physically impossible. So what do you do in that case? You just don't feed your baby? Like, I'm kind of afraid to post this online because it's very strong schools of thought. Breast is best, and then it's like fed is best, meaning like I think the best thing you could do is like make sure your baby's fed, right? So what if you're only producing a tiny bit of milk, but you feel stigmatized against using formula because people will shame you and say, oh, you shouldn't use formula, you should use breast milk. And then your baby is having something called failure to thrive, which is because you're not producing enough milk to actually feed your baby, but you're not supplementing with formula because people are shaming you about formula. I honestly didn't realize like how big of this like cultural like mom guilt and like shaming stuff comes along with having a baby, but the whole like breastfeeding or not breastfeeding thing is like a really heated debate, and a lot of people, just because breastfeeding came maybe easy to them and they feel like it's the best thing, they kind of put that onto other people, but other people were like, hey, like I literally can't produce milk, or it's excruciatingly painful, or like I'm working 2 jobs and how am I supposed to breastfeed and work 2 jobs? And what if I quit one job, then I'll lose my house and my baby and I will be out on the street. It's not like a passive thing you can just do in the background while reading or like working, right? It is a 40-hour-a-week job. And it's not like, oh, you can just like pump or breastfeed while doing other things. Believe me, I've tried to like type or like get stuff done. I think you really have to consider each on a case by case basis and not just be like overall like everybody should breastfeed or overall like everybody should formula feed.